This is lecture number 11. Today we are going to talk about cancer, specifically on how we define cancer, about the classifications and different stages of the diseases, and what kind of procedures can be done in order to identify early, and we'll call it cancer screening, and also existing treatment methods and some information on how we can diagnose and prevent cancer. So we expect from you that you can clearly define cancer and explain the hallmarks of cancer that we're going to cover. Also, you should be able to categorize cancer based on the origin of cell and also distinguish cancer staging. So you need to be also able to explain, and you need to understand different treatment methods and different types of differential diagnosing, specifically for breast, uterine, cervical, and uterine skin cancer. So what is cancer? This is a burden on healthcare in many countries, where this is a group of diseases. So it's a huge group of diseases that encompasses uncontrolled growth of abnormal cells. And it really affects every part of the human body. And interestingly, it arises from the cells that we normally use to manufacture our tissues. So when something goes awry in the cell division, when some mutations arise, and that would lead to the mutations in the chromosomes, that the consequence of it will be the formation of cancer. So the mutations can be acquired during the lifetime of the patient, and they can be other types of mutations based on the family background, who early developed cancer at an early age or had different types of cancer. So there are different multifactorial factors that affect the arising this type of disease. So there are different terms that you need to be able to memorize. That is called, first it's tumors. We call tumors when we see masses of tissues that are abnormal. And these tumors can be either non-cancerous or cancerous, so they can be either benign or malignant. And these malignant tumor, they are abnormal in a way that there is no at all control in their division, so they can divide it limitlessly without any control. Therefore, the progression of cancer from stage 1, 2, or from stage 2, 3 is very rapid and dynamic and dramatic as well, due to this uncontrollable division of cells. And cancer can start being localized, and it can also affect nearby tissue or even distant tissues. And when it invades other areas of the body, we call it that these cancer cells are metastasizing. So normally this is the later stages of cancer, and the treatment is also should be systemic in the form of chemotherapy or hormonal therapy that we're going also to cover in this lecture. And also there are different types of staging based on the process of cancer development, and also the extent to which this cancer is being developed and how it's spreading. And lastly is neoplasm, that is also defined as a growth of tissue which does not have any specific physiological function. So we can notice neoplasms in skin cancers, for instance. So here comes historic moment. That's a publication of paper by Hanahan and Weinberg in 2000 that was called Hallmarks of Cancer. Two authors published a paper in Cell that gathered the high numbers of citations, and it was called the really big success in identifying a therapy and also to allow the scientists who want to find out the new pathways for treating the disease. So we now we're going to talk about these hallmarks that affect most of the cancers. So it is the work of 15 years of work of looking at the papers that were published and collecting data and coming up with 6 statements that is shared among most of the cancer types. So for the cancer type here, it needs to have 6 characteristics. First, it's self-sufficiency in growth signals. It means that cancer cells does not depend on any growth factors or hormones to maintain its growth. It is completely independent to promote its cell growth. And second, it's insensitivity to growth inhibitory signals. When the normal cell develops, when it grows and divides, it fills the space that it fills up. When the normal cells is filling the space, there is a contact inhibition that tells it to stop to grow, and then the normal cell would stop the cell division and uh, will remain the shape or the size that it usually has. However, in the case of cancer cells, there is absolutely no contact inhibition. There is no reaction to growth inhibitory signals that is usually working very well for normal cells. So as you can see, when these signals are being ignored, the cell will just divide limitlessly and without any control. Third is evasion of apoptosis. Apoptosis is a programmed cell death that normal cells would undergo when something goes abnormal. So the normal cells would commit a suicide, and that is caused like a cell death. However, in the cancer cells, cancer cells have succeeded in evading apoptosis, so they have some mutations in the proteins that trigger apoptosis, and they completely find to overcome these programmed cell deaths. So they just grow, multiply, and without being killed at all. The fourth is called limitless replicative capacity. So, which means that the cancer cells can divide without any limit, so it's their multiplication division is indefinite. How it occurs is, as you remember from our past lectures, we have chromosomes, and chromosomes have ends, and in these chromosome ends we call them telomeres. As the cell ages after having been divided for so many times, this telomere gets shortened, and as it gets shortened, the cell would go senescence or cell death. So it's kind of aging. Whereas in cancer cells, they do not have the shortening of telomere. So it always stays long, and which transmits a signal that the cancer cell should multiply without any limit. The fifth is sustained angiogenesis. Angiogenesis is the formation of new blood vessels. So, what is really important for the normal cells is that to maintain, to grow, they need to get oxygen that is coming from the blood. So, normal cell can get the glucose, oxygen that would promote its growth. Uh, in case of cancer cells, is that they always have these nutrients coming, oxygen coming through the formation of blood vessels that bring them all this, and they really provoke the growth of blood vessels. So they use the formation of blood vessels for their own benefit so that these tumors would multiply and grow further. The sixth, is called tissue invasion and metastasis, is that uh, they are very uh, well at invading local tissue, neighboring tissue, and even spread to distant organs. So, in terms of normal cells, it is not the case because they have this contact inhibition and they can just stay in locally without traveling further to distant organs. However, in cancer cells, they they're very good at invading. So they have this ability to metastasize. And here you see the picture. In the core, you have the um, blood vessels. Yeah, that is your angiogenesis that's bringing oxygen and nutrients to the formation of cancer cells. And here you have your fibroblastic cells, and these cells which are in round, it means that they have orange shape and something wrong going in the genetic information, that they do not abide by to the normal rules for DNA repair, and they just start to leave the local site in order to evade neighboring tissues and even distant sites. So here you have all these 6 hallmarks, and now if you look in the Google search, this paper has been cited for more than 45,000. So it's the most citable paper so far. And even if you go to any cancer conference, it is absolutely normal routine that all the cancer researchers would start their introductory slides by referring to this paper. To continue, there are different terms related to the cancer classification. So, depending on the cell of origin, we can categorize cancer into carcinoma, sarcoma, leukemia, lymphoma, and central nervous system cancers. So, carcinoma, it means that it develops from epithelial cells. So, that is the cells that make up the skin or tissue lining organs like kidney or liver. And sarcoma, it's a cancer that begin in the bones and in the soft tissues, like connective tissues, be it bone, cartilage, fat, vascular tissues. Leukemia, from the Greek, leuk, it means white, and haima, it means blood. So it's white blood cells. Leukemia cells are those cells which are immature white blood cells. And you know that this we have in our bone marrow, we have the development and differentiation of our red blood cells that carry oxygen to tissues. We have white blood cells that fight infections, and we have platelets that allow our blood to clot. Yeah, so that our blood cannot bleed. And when something goes wrong in the bone marrow, with the leukemia, we have something going wrong in the bone marrow in a way that you have more of the immature white blood cells production and taking over in terms of quantity rather than red blood cells or platelets, so the whole body system will really suffer from it. And these leukemic cells, once they enter into the blood, um, they are very immature white blood cells. They cannot fight infections, and it's mostly it's prevalent in kids, but also other types of leukemia are frequently happening in adults as well. So next is lymphoma. It's cancer that begin in the cells of immune system, and central nervous system cancers that begin in the brain and tissues and the spinal cord. Regarding the staging, we have 4 different stages. So the severity of the diseases and the treatment complication starts increases as the stage grows from 1 to 4. So at the stage 0, it's described in a way that there is no invasion of surrounding tissues. It's mostly localized. So the treatment is excision, so it's a removal by surgery or laser therapy. So laser therapy, it's without using scalpels, but using the laser beams in order to uh, cut the tissue with the paper. Stage 1, it's when the doctor can see the localized metastasis present, and he will advise to for the patient to have a surgery in order to remove the organ or the tissue, and then they will send that tissue or organ to histology department, and the histology department will look at it under the microscope and perform different staining experiments and tell whether the tissue has good sign for not being malignant or being malignant. If the result says that it's being quite malignant, then the doctor will take out more of the tissues in order to be sure that the cancer cells have been removed. Stage 2 is when cancers are localized to one part of the body and they involve the lymph nodes. In that case, the treatment options will include chemotherapy and radiation. So that is including surgery. So chemotherapy would be systemic treatment and radiation being localized treatment. And stage 3, it's when the cancer was able to spread to adjacent tissue, so it has started to metastasize, and there will be a combination of therapy, including both chemotherapy and radiation. And the last stage, which is the advanced stage, and patients at that stage have very low quality of life, and they are staying mostly in the hospital or being taken care by healthcare workers who provide palliative care, and their cancer cells have migrated to distant organs, and they are found in other distant tissues and organs and traveling throughout the body. So here what is important is to have this palliative care where healthcare workers work with those patients psychologically, and they address any pain by giving those patients the pills and preparing them for uh, uh, for other complicated consequences of the disease. So symptomatically, there are just several of symptoms which I given here. So this list is not final. When there is ulceration, pain, bleeding, These are the symptoms that the patient needs to have a checkup, ultrasound checkup, or um, having a blood test for different markers depending of where the bleeding has occurred. So if it's in women over 55 years and if they are postmenopausal and they have their bleeding, that can be a sign for the polyps, endometrial polyps, or uterine cancer. So it needs to be closely monitored. So those are for the local symptoms. And for the systemic, it can be immunological imbalance or fatigue and very severe weight loss. For the cancer cells that have been metastasized, there will be some enlargement of spleen, that is splenomegaly, or enlargement of liver, that is hepatomegaly, or enlargement of lymph nodes. So those are all the signs that the body is suffering, that there is a response from our body system to address the problem that is occurring inside it. So these all will be enlarged, the liver will be enlarged, the lymph nodes will be undergoing some changes in terms of their size, that they are very heavily affected. And other symptoms can be just malaise, that is feeling unwell, or fever, or appetite loss, which can even lead to the weight loss. So when the cancer can be avoided is that when patients can have regular checkups. And these checkups are very important, and it's considered as cancer screening. So in our republic, for instance, we have cancer screening for young girls, that is, I think, 13 years old, when they have this Papa Nicolaus smear in the uterine for the uterine cancer, and also mammography for the women in order to uh, make a prophylaxis for the breast cancer. It was told that in many developed countries, cancer screening cuts high expenditures to treat cancer. So this is a prophylaxis, and it is the method for the cancer screening should be affordable for the people to have it, and also it needs to be cost effective. It needs to really detect the cancer early, and it needs to be precise without giving false negatives or false positives and so on. So we have different cancer screening for a group of cancers like breast, cervix, colon, or prostate. So for breast, it's a mammography. For cervix, it's a Papa Nicolau smear. For colon, it's a colonoscopy, and prostatic ultrasound for the prostate one. So also, if the individual feels and observes some close relatives, or in a family tree there were people who had cancers, they can have genetic tests which would find out the expression, some mutations in chromosomes, or expressions of gene who has been associated with the development of cancers. For instance, women who had a higher expression of BRCA1 or BRCA2, they voluntarily removed their breasts in order not to, since they had the more predisposition to develop that, but it's not 100% true that they will develop it in their own lives, but it means that they have more probability of developing that type of cancer compared to those people which do not have expression of these genes. Also, there are another genetic markers, and for instance, if the patient had some symptoms for that specific type of cancer, he or she can take a genetic testing to see whether he's predisposed to that or not. Now let's talk about the treatment, how it can be treated currently. So there exists, depending on the stage of cancer, accordingly different types of treatments are available, be it local, systemic, or supportive. So for the locally, it's a radiation that uses high energy rays to focus on cancer cells, and these rays are emitted from specific metals like radium, and they really focus on the cancer cells to eliminate them, or in a way that these cancer cells commit suicide, so they will just be go through the apoptosis process. So this another side effect is that the early radiation treatments, they can cause side effects in a way that they also damage normal healthy tissue, but nowadays they are more targeted, more accurate, that they focus on the cancer cells. So chemotherapy, it's a systemic type of treatment to treat cancer, is that it employs the use of drugs that acts to block the cell division, to interfere with the cell division process, and this way it will damage the proteins and DNA so that the cancer cells can no longer divide and grow abnormally. And the problem is that this chemotherapy, it is targeting any dividing cells, be it healthy or non-healthy, so that the damage caused from this treatment uh, necessitates the time so that the patient can recover from it, and then he or she can take it after some time. So there is a kind of treatment dose that occurs between the treatment time that is available between the doses. So this type of therapy is applied only to those cancers that has spread to neighboring tissues, or it has spread to distant organs. Another way, if the cancer has been metastasized, so that the introduced drugs can travel throughout the entire body. And the supportive care is delivered by palliative care, and it was announced that people who was receiving this palliative care lived much longer than those who rejected this type of care. So this is delivered by healthcare professionals, by doctors who accurately assess and treats pain, who who are very supportive psychologically and psychosocially, and addressing the needs and relieving the pains of people at an advanced stage of their disease. Now let's talk about some types of cancer which are prevalent, which are very common in women. So this is the breast cancer, and the symbol of breast cancer awareness is demonstrated by wearing this pink ribbon, and it's basically malignant tumors that starts from the cells of the breast. Risk factors can be is that it's mostly prevalent in female with increasing age, and if they had in their family history mother or sister who had this type of cancer, then that patient is more has more probability of developing it, and also early onset or late menopause of these cycles can also affect the development of it, and so on. How it can be diagnosed? The simplest form is mammogram, in a way that the woman puts her breasts onto the two plates, which will emit low dose of X-rays to identify whether there are some changes in the breast tissue. So it's a very quick method, and in our country also women are advised to have this mammography. And how we can prevent this type of cancer is to look what we eat, to watch our diet, and to have this regular checkups for mammography. So we can treat breast cancer by either surgical or non-surgical treatment. So non-surgical treatment would include the application of hormonal therapy, that's for systemic, radiation therapy for localized, and chemotherapy again, which is systemic. And surgical intervention involves the removal of entire breasts. If it's a single entire breast, then it's mastectomy, and if it's the removal of both breasts, just to be sure that completely removal of breast cells, that is double mastectomy. Also, there is this alternative that is to conserve the breast. Then only the part which contains the cancer cells will be removed, so that not entire breast. Next, it's a uterine cancer. It's a fourth common type of cancer among women, and women over 55 years are in the risk. And the risk factors again is age, it's diabetes or obesity, and also women with high hypertension, and also if they had undergone already estrogen replacement therapy. So how it develops the uterine cancer? First of all, let us remind that uterus is a hollow organ where baby grows, where embryo develops, and the whole development of baby takes place there. We have inner lining of the uterus here, that is called endometrium. So this endometrium, when we have cells abnormally growing, it will affect the tissue in a way that it will cause endometrial cancer or uterine cancer. Though these are two words which are interchangeably used. How we can diagnose it? It's by a transvaginal ultrasound, which means that the sound waves will give us a picture of an internal organ, and a specialist can tell if it looks very thick, then he or she would advise a biopsy. Biopsy is taking a small sample of tissue in the uterus for testing in a laboratory, where the tissue sample will be observed under the microscope, and the pathologist will give his result, and with there are some changes, abnormal changes or normal changes, and that will be the most accurate type of method used for diagnosis. Another type is dilatation and curettage, which means that removing the tissue sample from the uterus of woman once she is being given the anesthesia, so she's unconscious of the pain, and the doctor at the same time views the lining of the uterus. And hysteroscopy is observation of the uterus. So how we can prevent it is that watching our health conditions, so that any vaginal bleeding in women after 55 years is really important. So any case should be reported and taken care of. And also high blood pressure and diabetes, which are common risk factors for this type of cancer. Treatment can include the removal of uterus or applying the laser surgery to perform the laparotomy. So laparotomy it's incision made in the abdomen, or radiation chemotherapy, and also hormones or hormone blocking drugs are given to the women in order to regress the growth of endometrial cancer cells. And also a very important one is anti-angiogenesis therapy, which is focused to stop angiogenesis, to stop the formation of new blood vessels that would supply nutrients for the growth of cancer cells. Now let's talk about another type of cancer that is frequent in women, that affects women between the age of 30 and 45. It's called cervical cancer. Anatomically, it's cervix. It's in the lower end of the uterus, this is the uterus where the baby develops. And the major cause of cervical cancer was considered to be HPV, that is human papilloma virus, and it is sexually transmitted. So it was found out that also that HIV positive women tend to develop cervical cancer more frequently and more rapidly than people without HIV. And the sexual transmitted HPV strains are HPV 16 and 18, and they produce the protein that causes the epithelial cells of cervix to grow uncontrollably. In order to prevent this type of cancer, is that girls need to be vigilant in order not to have sex in the early age, and also not to have numerous partners. And now there is a HPV vaccine available, so they can get vaccinated and have these regular pap screening tests. So this is the vaccination and pap screening. It is short name for Papa Nikolaus, which means that the sample from the cervix will be taken and looked under the microscope to see any abnormal changes in the tissue. So there is also colposcopic biopsy. The colposcopic is given here. So this is a colposcopist who examines the cervix with the colposcopy machine. And another, so this is like in real time, they can see the cervix, the condition, and any changes in the tissue. Regarding another express test, it's called Schiller test, where we can apply iodine solution to the cervix, and we can see whether the cervix will stain brown or not. If it stains brown, it means that the normal cervical mucosa, it contains the glycogen, and we know that glycogen is a carbohydrate. Yeah, it's an energy storing carbohydrate, so it will be staining brown in reaction with iodine solution. However, abnormal areas of cervix, we will not take up the stain. It means that they do not have this glycogen compared to normal cells. Treatment options would start with surgery, be it cryosurgery with the application of liquid nitrogen that gives extreme cold to remove abnormal tissues, or it can be laser surgery with the application of laser beam to vaporize soft tissue, and it can be also radical hysterectomy that is removal of uterus and its surrounding parts with laparotomy, that is the same as in cesarean section that puts incision in the lower part of abdomen. So now let's move on with other type of cancer, that is leukemia, and we call it as a cancer of white blood cells. So as mentioned, these white blood cells, they are key players in the immune system to find any infection that is caused by different pathogens. Yeah, so they are our key, they are players to attack the pathogens. So what happens in leukemia is that these white blood cells will just be dividing. These immature white blood cells will be dividing rapidly uh, without any control and stop, and we will have less amount of red blood cells and platelets, which are really needed for the body to maintain its continued existence. And these immature white blood cells, they are incapable of fighting infections, so also there is no use of having in multiple forms of them. So as you can see, the whole system just suffers from having these abnormally formed white blood cells. So we have actually bone marrow. This is a spongy tissue in our bone. We have the formation of hematopoiesis. That's the formation of blood cells, be it platelets, white blood cells, or red blood cells. And leukemia heavily affects bone marrow, causing the suppressing the production of red blood cells and platelets, and even the normal functioning white blood cells in a way that the person would get anemia, that is the low number of red blood cells, leukopenia, low number of white blood cells, and also thrombocytopenia, low level of platelets, that it's involved in blood clotting, and overall it will affect decline in immunity. How it can be diagnosed? We would look at abnormal red cells. Also, we can also take with the syringe, to take soft tissue, liquid from the soft tissue. That's called bone marrow aspiration. So it's a very, very fine work to take the liquid from the bone marrow. It's a very spongy tissue, but it's very precious that it contains all the blood cells. And then what we do is that we examine the condition of blood cells. Where are they in a good balance? Their shape, are they normally developing or not? So that would be a method for diagnosis. And how we can prevent is that this type of disease is very rare, and the cause is also unknown. So generally there is no specific preventive measures that can be offered. However, high dose of radiation and chemical exposure, for instance, to benzene, should be avoided in order not to develop this type of cancer. So how it can be treated? One of the methods is transplantation of bone marrow between the healthy cells. So replacement can be either coming from the patient itself or from the donor, so that once we have successful transplantation of bone marrow, we would be able to see the synthesis, the formation of blood cells. Other more systemic treatment would be radiation, the chemotherapy, or localized radiation therapy. Now let's finalize it with talking about skin cancer. So skin, it's basically neoplasm that is formed on the skin, and it can have different degrees of malignancy. So it can be either benign or carcinogenic, malignant. There exist also different types like basal skin, squamous cell carcinoma, or malignant melanoma. So this is the very dangerous one. Main reasons it's exposure to UV light and X-rays, so multiple exposures, prolonged exposures could provoke the development of skin cancer, and also general suppression of the immune system, and including genetic factors would be the uh, provoking the risk for this. So basically the cause is not known. How we can diagnose it? By taking the skin biopsy, and we would suggest to stay out of the sun at high peaks, that is from 10 a.m. to 4 p.m. Always to apply SPF cream, that is cream containing sun protection factor of at least 15. And there exist different types of treatments, including Mohs surgery. So Mohs surgery, it's removing the cancer-containing skin with thin layers and leaving only cancer-free tissues. So that's called for Mohs surgery. And also there is curettage or electrodesiccation, that is using a spoon-shaped instrument called curette, and scraping the affected skin surface. Cryosurgery as well is a use of with the liquid nitrogen to remove the abnormal tissue. Laser surgery to remove the skin neoplasm. Thank you for your attention.